Welcome to the Curated Beauty Podcast, where we dive into all things health, wellness, aesthetics, empowering you to look and feel your absolute best. I am your host, Jessica Christie, and today we have an incredibly special guest who's truly changing the game for women navigating one of the most challenging transitions in life, perimenopause and postmenopause. Joining us is Karen Martel, a certified hormone specialist, transformational nutrition coach, and women's weight loss expert. Karen has made it her mission to disrupt the outdated narrative that suffering through perimenopause and postmenopause is quote unquote just part of life. After experiencing debilitating hormonal shifts herself, Karen quickly recognized a massive gap and realized that reliable information for women during this phase is present. She's here today to tell us that it doesn't have to be that way. You do not need to suffer through this transition. Karen equips women with evidence-based tools to support and take control over their own hormonal health, empowering them to live vibrant, fulfilling lives through this transition and beyond menopause. We're going to be diving into everything from hormonal optimization to the myths surrounding menopause that keeps so many women from thriving. Get ready to be enlightened by this conversation and empowered and inspired. I don't think that this episode leaves any woman not feeling seen and heard. Welcome, Karen Martel, to the show.
Hi, I'm so happy to be here. And as we were just talking off air, we just have so much in common, and our passion for women's health just aligns really, really well. So I'm excited to be here and for this conversation.
Me too. I find these the most enriching conversations because they're so applicable to our own health. And with that, I would love to hear how you started in this space and what you're doing in this space and how that journey happened and evolved.
Yeah, so I was doing a lot of body work. So I was a Rolfer. I don't know if you've heard of that before. It's like deep tissue body work. And I was doing that for like 20 years in my own little private practice. And then I had my own kind of health crisis. Of course, that's how we always get into these things.
Yes.
Where I had my daughter. I had got pregnant, and post-pregnancy, I had suddenly like about a year after she was born, I quit breastfeeding at that time. And then I had like all these crazy health problems start coming my way. When I was a healthy person, I was doing everything right. I was, I didn't have any like food addiction. I wasn't eating like crap. I was always a healthy eater, and I was in the space of like holistic healing. So I feel like I was, following the right path. And I suddenly started to gain weight, and it was rapid weight gain out of nowhere, hadn't changed anything. I was having severe digestive problems. I was having PMS that would last for weeks at a time, menstrual migraines that would last for 10 days straight, and sudden insomnia where I couldn't sleep, and I didn't sleep for months. And it was, I'd be awake till like 3 or 4 o'clock in the morning, and then kind of fall asleep for a few hours. And then my little girl would wake up, and I was a single mom. And so I had no help. And I started just kind of going down that rabbit hole of, well, what do I do? And everywhere I turned, it was like, well, work out harder and try this diet. And so that's what I did. I tried every diet under the sun. I did Atkins. I was just doing the Zone. This is, back in 2007. So I just tried it all. And I started to go to CrossFit and started working out every single day like a mad woman, and tried to become a runner and like just all the things that women do. This is what we do. Starved myself, calorie counted, was sometimes eating like 800 calories a day because I was like just so desperate to get this weight off because I was at the heaviest I'd ever been. And I just kept gaining weight no matter what I did or how much I starved myself. And I finally was like, what is going on? So I went to the doctor. She gave me an antidepressant. She gave me a very like hardcore sleeping pill. and kind of just sent me on my way. And I did that for a while and then was like, this is not getting to the root of the problem.
Yes.
And I knew then, like, I was like, this is something hormonal. And I could tell. And even though I was like 33, I was like, this is something's going on. And I ended up going to a naturopath friend and saying, could you test my hormones? And sure enough, all these problems were with my hormones, and my estrogen was super high. I had no progesterone. My cortisol was flatlined. I had no DHEA. And so I was in this state of adrenal insufficiency, which is just very low cortisol, like adrenal fatigue is what it was once called. And what was I doing? I was doing everything wrong. I was starving myself. I was working out like crazy. I wasn't sleeping. And so I had to have this massive life shift, and where I quit doing all of those things. I started doing yoga. I started, asking for help. I never considered myself a stressed out person, which was really funny.
Right.
But I had to go, oh, maybe I am stressed out. Like, this is normal, but this is not normal for my body. And eventually, the weight started to come off, but it was a long journey. And I came out of that going, I can't be the only woman that this is happening to, a woman that's doing everything right. I wasn't drinking. I was eating super well. I was exercising. And yet I still had all of these problems. And so I kind of went on this mission to educate other women that, hey, you could be doing everything right and this could be happening to you. And I kind of got everything straightened out, became a nutritionist, and several years later, and started my own practice of counseling women with weight loss. And then thought I had it all sorted. And then when my early 40s hit, I hit early perimenopause and menopause and discovered I had a thyroid problem, which was probably what started the original issue as well. And started to lose my period, having hot flashes and night sweats. And within a couple of months, I put on like 15 to 20 pounds. And this was super embarrassing. I was a weight loss coach, and this was happening to me. So it was like this whole thing repeated itself, where I was doing everything right. I was doing even more so right. I was now not starving myself, and I was balancing my stress and doing all these things. And yet this still happened to me. And I was in the industry. And I was like, how is this happening? Right. And started to realize that the information out there, majority of it was wrong, that we were being told by medical professionals. And that the information around things like bioidentical hormone therapy and weight loss, again, but in midlife, it was wrong. And women were not being supported. We were told to kind of suck it up and get through this time, which, lo and behold, could be 10 years of perimenopause before anybody's going to help you. And it's like, why are we being dismissed like this? And so I ended up going back to school. I became a hormone specialist, and I started to kind of basically be this advocate for women in perimenopause and then eventually in menopause, and trying to get the information out there that we have options and we don't have to suffer like this. And I was able to reverse my own menopause and, lose the weight and get back on track. And I'm 48 now and feel and look better than I have in a decade. So I'm now trying to help other women that are going through the same thing.
I love that. Your story, anyone who's listening, the story is something that we hear every single day. It is so classic. There's something so beautiful about childbirth, but there's also something that is such a sacrifice of our bodies that it really sends it into haywire. And without proper counseling on what's going on with our body and proper support, it is no surprise that that's the beginning of us feeling like we're put last, back on the back burner. And it's the beginning of dysfunctional situation after dysfunctional situation, all the while caring for everyone else, but being expected to be that caregiver. And I'm assuming that when you went to your doctor and you were complaining about these symptoms, they took your labs, they told you that they were all normal. They told you that it's too early to check for hormones, even if that was a thought. And again, every single book that we read on hormone replacement therapy, every story that we hear, it's the classic story of here's an antidepressant and here's a sleeping aid, because those are the symptoms that we have. Even postpartum depression, I just look back at the symptoms that I had and the crashing of the hormones, the thoughts that you have, the night sweats there. And I just think, man, if I would have known what I know now, I could have really not necessarily breezed through that transition, but I at least wouldn't have had some of the health implications keeping me from fully embracing that new change in our lives. And I think we can make that so much more beautiful for women starting there, which I don't think that it resonates with women. You're thinking you're fertile, you're young, you have these, you're clearly making babies. And this is the time that you think you're going to look back on and think, wow, those were the days. But even that early, there's a place for your support, my support, hormone replacement, even temporarily to get us through some of these humps.
Yeah.
And I think too, when you look at your transition from doing all the things right, quote unquote, to moving to yoga, less stress, eating again, all the things, like this is, again, if we're honest with ourselves, we've all struggled with those things that you're so upfront and honest about. I think about how scary it is to step away from those things that even though they're not working.
Gosh, I know.
Like you want me to eat 2,000 calories? Like you want me to trust that my body, knows what's right? Or it's just, I give you kudos for really being a trailblazer, because that's what a lot of us women have had to be with our own health issues. We've had to say there has to be something better. And now you're advocating for other women.
Yeah,
so
it's
now,
crazy.
What does your medical practice of this hormonal health look like?
So we have a telemedicine clinic throughout the United States and in Canada. We can now prescribe hormone replacement therapy in every state, British Columbia and Alberta in Canada. And so it's really expanded. We have the private coaching where we can offer prescription hormone replacement therapy, but we come from a very functional place, which I think a lot of hormone clinics are lacking. A lot of them are just like, here's your pellets, and here's your hormones, and we'll see you later. And unfortunately, it's not usually that easy for women. There's a lot that goes into hormone replacement therapy and midlife, and what we need to start looking at in midlife. We have to start doing things differently. We got to start working out differently. We have to start taking care of our skin differently, our hair differently. We got to watch our stress levels differently, because we know that in perimenopause and menopause, cortisol tends to go up in women. And at the same time, we're losing these very vital sex hormones like progesterone, which is this beautiful buffer to stress. So we can't handle that anymore. Thyroid starts to go down. So all of these things are changing. And we as women will tend to just go to what has worked in the past, which is the calorie counting, calorie restriction, working out, cardio, running, treadmill, and pounding the pavement. And then still on top of that, we're still expected to work full time. We're still the main caregivers of children. And so this pile up of all of these things coming at us needs to change. Yeah. And so in our practice, we really try to, touch in on all of those things. It's like, what's the holistic look at your life right now? It's not just like, let's slap the hormones on. It's more like, how's your digestion? How's your lifestyle? How's your stress? What exercise are you doing? Are you lifting weights? How's your diet? Are you prioritizing protein now that you're in midlife, And so we really take it from that functional standpoint. And then on top of that, we've got our own line of bioidentical hormone cosmetic creams that people can purchase just without a prescription, which is really nice to have that available to the masses because a lot of people can't get them from their doctors. Their doctors refuse to treat them as well. They can't afford to maybe go to a hormone specialist. So we have that. And then we also have a couple different group coaching memberships, one for weight loss, and then another one for the hormones and perimenopause and menopausal women. That's just an affordable option, once again, for women that maybe can't afford the private calls, because we're really trying to reach all women that want the help, because we know life is expensive right now. And so we really wanted to be able to make this available to the masses of who wants it. And so I think we've done a pretty good job of doing that. And it's still growing, of course, but that's kind of where we've ended up.
And I love that because you're right. It doesn't have to be so black and white, like you're all in, you're doing every single thing. There's space to be held for even just appreciating, like someone might not be ready to dive in, or they might even not believe in everything that we do. But even just the concept of a little estradiol on our skin as we're losing estrogen, there's estrogen receptors everywhere. And I think people forget that, or they don't know that. Being able to see the change in one area and maybe reap a little bit of the benefit systemically, it's just really, that could be someone's, gateway to exploring a whole new world of wellness, and not just accepting the, 10 years of battling and then thinking the symptoms are over. Like, let's dive in a little bit to the long-term implications of what being devoid of these hormones could do.
Mm-hmm. Yeah, because the standard medical practice around hormone replacement therapy is either you don't get them, right? So most doctors aren't educated in the safety and the research behind hormone replacement therapy. And that's all, of course, stemming from the Women's Health Initiative. And whether or not your listeners even know, if you're afraid of bioidentical or any kind of hormone replacement therapy, whether you know it or not, it's stemming from the Women's Health Initiative, which was very misinterpreted. And so there's this massive fear around hormones and that they're going to give us cancer. And so women are being denied hormone replacement therapy. And if they're not being right out denied them, they're being told that they cannot have them until they're in menopause. Mm-hmm. And we know that perimenopause is getting longer and longer. It's starting earlier and earlier in women. We're seeing it usually arise in their late 30s. Sometimes it's going even mid 30s, where women are starting to drop in certain hormones and starting that perimenopause journey. And as we start going into our late 30s, early 40s, things tend to be, for most women, they tend to start happening then. And I would say 80% of women, that's when you're going to start to feel the effects of the dropping hormones. But yet menopause, which is considered 1 year with no period, the average age is 52. So you think, late 30s, early 50s, you've got this 10 to 12 year time span of when those years tend to be worse than your menopausal years. Mm-hmm. And so we're being stuck going, okay, I've gained 20 pounds. I'm hot flashing and night sweating. I've got anxiety. I've got depression. I can't sleep. My skin's dry. I'm aging rapidly. I'm losing my hair, bone loss, heart problems, blood sugar problems. All of these things start to happen in the perimenopausal years. Mm-hmm. Not so much yes, it's going to continue to happen in menopausal years, but why are we waiting? Why are we waiting to treat women? And what we're being offered as women is, number one, hysterectomy or birth control pills for symptoms, right? Because women, when we start to lose our progesterone, which is the first hormone that typically goes in your late 30s, early 40s, because we don't ovulate as often. And once we stop ovulating, we don't produce the bulk of our progesterone. And so without progesterone, women start to bleed heavier. And so they'll say, like, I'm bleeding every few weeks. They're super heavy. I'm cramping really bad. This is terrible. And so the doctors say, you have the choice of birth control pills, you can have a hysterectomy, or you can have an ablation. Those are your top choices that are going to be given to you.
Mm-hmm.
And none of those choices fix the root of the problem, which is typically, not always, but typically the loss of progesterone. And then women will try and do things like supplement their way out of this time.
Yeah.
Supplement their way out of the loss of hormones. They'll try and diet their way out of it. They'll double down. They'll say, okay, I got to intermittent fast more. I got to go lower carb. I'm going to take these, menopause supplements, which all of those things can be great. And we want these as like foundational pieces. We want you to be healthy. We want you to eat well, all of these things. But you can't supplement your way out of hormonal loss at this time. Nothing's going to bring back that ovulation.
Mm-mm.
Once those eggs are gone, they're gone for good. You can't bring them back.
Right. It's so interesting to me because I, like you, have a similar story where, after children, my husband would say to me, you are, and he wasn't saying this in a mean way, but you just feel so desperate. So you do take it personally. And he would say, I just feel like you are the sickest, healthiest person I have ever met. And my immune system was low. My energy was low. I think such a telltale sign for women in those ages where you're childbearing, but you're going through these things is when you wake up in the morning, first of all, you can't wait to get your coffee. And second of all, you kind of like, I remember thinking, and I used to feel shame about this, but I remember thinking, gosh, I can't wait until bedtime. Like that is not living, but it's real. And all of a sudden I got a huge multinodular goiter, went to an endocrinologist. They, told me to get it taken out. All your lab values are quote unquote normal without really dissecting, like, what are they doing? Like, is my T4 turning into T3? Like, are we just looking at TSH and all the things that I now know to look at? There's no crossover of considering thyroid an actual hormone and how does that play into our bioidentical hormone replacement. And I remember thinking like, wow, I'm, in my mid 30s, like having these babies, and how, like, could I actually need hormones at this point? And then you just have to be on them forever. And I think that is a valid question that women ask, but what is the alternative? Like, we clearly are doing it wrong. I don't ever see a mom with young toddlers that claims to be well rested, not stressed out, sleeping through the night, loves their skin, feels like bright and shining. Like, it's the years where you truly are in the back seat. And I just think when we can implement something like hormones as a foundational resource, and like you said, all the other tools are so important. There's supplements that are going to be unique to each, that thank God for experts like us that know which ones. We don't need to be on 8,000 supplements and spending, tons and tons of money on things. But how can we get back to the basics with prioritizing sleep, but having tools to actually do that and to feel better? And so I think that that's really relevant, what you say, where this is happening earlier and earlier. We can either say that it's not or deny that that's a truth, or we can accept it and implement really key ingredients to be able to live longer and stronger. And I think there's also a thought of going through menopause and thinking, okay, now the symptoms are finally abated. But then that's where we really start to see the benefit of hormones shine in terms of protecting our hearts, protecting our bones, protecting our brains, while still bringing the other things with us. Like, we're still active, but we're able to do those things because we actually feel good.
Yes.
And then the last thing I would say in terms of the other thing that women struggle with is, let's talk about our relationships from that late 30s to early 50s. When we have zero libido, I think how impactful that is on relationships, especially through those trying years of children and young babies. My husband and I always joke, like, once one partner gets hormonally optimized, like the other one is not far behind because it's truly a change that you can see in your relationships. Are you guys seeing
Yes.
women and men, or are you mostly seeing women at this point in your practice?
We mostly see women, but it's funny how many of them will come to us after we've treated them to say, will you treat my husband too? We're like, yeah, guys, bring it on. We don't advertise that we work with men,
Yeah.
but men are so easy compared to women.
They are so easy, especially perimenopausal women compared to men.
Yes, 100%. So yes, we will treat men as well. We just primarily treat women, but just by default, we'll see the husbands, no problem. My husband got on board too. Like he was going through midlife changes and we tested his hormones and it's like, okay, start a little testosterone. And he feels like $1 million now and he looks amazing. He looks better than he did in his 30s. And so
it's so crazy.
It's great. And then we match up too, right? I started replacing my testosterone. He's replacing his testosterone.
It's a much
yes,
better
the libido. Yes. Like I can't believe how many women and men go through marriage issues during perimenopause and live with it. Like when there's something that can be done. Like I just had a client this week who she told me that first she tells me that in the last year, she's really had a lot of perimenopausal symptoms where she's got her anxieties through the roof. She's got depression. She's got no libido. Then she tells me shortly afterwards, she's divorcing her husband. Mm-hmm. And I said, oh, when did this come about? And she's like, well, it's really been in the last year. And I'm thinking to myself, I didn't say it, but I was thinking to myself, oh no, like what if we start to replace her hormones? And then she's like, oh, I don't want to get a divorce.
And then the nail is in the coffin there. I know it's almost like something that we have to bring awareness to. Like it absolutely plays into our mental state, and how we make decisions. It's a huge relational type of
even with
concept.
your parenting, right? Like how much does our parenting get affected by these hormonal changes?
Yeah.
I mean, it's huge. Women will say, I have no stress tolerance anymore. Like I fly off the handle at the drop of a hat. I'm crying. I'm getting angry. And your poor children are like, oh my gosh. And women will come to me crying and being like, my family doesn't know who I even am anymore. And they just want old mom back.
Yeah.
And that's heartbreaking.
It is. And it's hard it's hard on a child's nervous system. And, as if we need to feel more mom guilt about anything, but it is such a easy solution. But I will say back to, I remember sitting on my kids' bathroom floor, like giving them their nighttime baths. And I was watching like an Instagram story from an OBGYN that has cared for me and talking about, hey, someone had asked a question, like, should I get my hormones checked? These are my symptoms. And she's like, no, first thing you really need to do is just look at your lifestyle factors and your stress level. And you just had a baby. So it's like a lot of unintentional medical gaslighting because they don't know. It's not even their fault. They don't get the training. I would ask, how in your practice, are you guys focusing on the lab values more? Are you focusing on patient symptoms? How are you approaching that situation? Because that's the reality. Most patients, even if they can get their OB to draw hormones, they're all within normal limits.
Yeah. Oh, it's ridiculous. Normal limits. So I'm in Canada. I live in Canada. And I was going through this woman's labs yesterday and I was like, okay, you can see here, like your estradiol is within range, but I'm like, our range goes from, I think it was 200 to 1400.
Yeah.
Like, yes. To me, I was like, this is so ridiculous.
And it's a snapshot in time as well. Like, it's just like,
snapshot.
This is where you are right now at this hour.
Yes. Yeah. So younger women, it's really hard to tell by lab values if there's a hormonal problem. With younger cycling women that are in their 20s and 30s, I typically try and get them to do a urine metabolite test because that's going to give us a much better picture of actually what's happening in her body with her hormones. How is she metabolizing these hormones? Is she pushing down the wrong pathways? What's her cortisol levels? And it just gives you a much bigger picture than what serum blood labs tell you. Blood labs are just such a wide range. Doctors won't tell you to take it on certain days of your cycle, which you need to do because our hormones change on a daily basis. So we want women to do it on day 21, but then blood work is only testing what's known as bound hormones. We're not seeing what's free and available for her body to use.
Yeah.
But a urine metabolite test will reflect free levels of hormones. So doing the Dutch with a serum lab together is always the best case scenario, but that's expensive.
It is.
So if, you can't do that, that's okay. Do the serum. It's better than nothing. And we can look at so many different things in, a whole big lab panel that we get. And we can see, if there's how the liver's doing, the gut, if there's infections and things like that. So you can tell a lot. And so it's still handy, but we have to also treat the person.
Yes.
And we have to say, well, what are your symptoms? Because for one woman, let's say like myself, I'm very estrogenic. Even when I look at my DNA, I see in my DNA and in my SNPs that I am estrogenic. And there's some people that are estrogenic, some are androgenic, which means that you're more prone to doing well with like higher testosterone and DHEA, the more masculine hormones. And so for myself, if I lose estrogen, I feel it. And so my labs could be well within range and looks great to any doctor looking at it. But yet there I am, hot flashing, night sweating, like losing the libido, feeling like absolute garbage, gaining weight. So because for me, I need lots of estrogen.
Yeah.
Rather testosterone, if I use a lot of testosterone, I break out in acne, I push down the wrong pathways, I get water retentive. It's, so I have to use just a little bit. Now, my sister is a good example of the opposite. She's androgenic. She's straight up and down. She's got no hips, no boobs, can't put on weight for the life of her. When I look at a dessert and I'll put on 5 pounds, so she's very androgenic. So her estrogen can get quite low and she doesn't notice it. But if her testosterone gets low, she will feel it. She can get depressed. Her libido goes. She has no energy. So it's really, and not everybody is one or the other. I'm just saying that
it's
a range. Very individual, and what somebody can tolerate as far as hormone levels, the next person won't be able to.
Yes.
So it's really, you really have to ask your women, the ladies, how do you feel? What are you experiencing? And so then, there's, depending on what age she's at, there's things that we can do that are, supplements and herbals and minerals and stress management and diet that can help balance hormones when you're still cycling. And that's, what could be best for you. But if you're in your later, 30s, early 40s and beyond, then you have to start to go, okay, your labs look okay, but yet you're bleeding super heavy. You've got all the signs of too much estrogen compared to progesterone. You're probably not always ovulating. So you're probably having anovulatory cycles, which means you're not producing progesterone during those cycles. And that's when you're going to need to supplement with some progesterone cream or pills.
Yes. Okay. We talked a little bit about the WHI study, which is the Women's Health Initiative. I love to bring that up any chance I get to just remind women this is a study that was done to really put this, concept of do hormones help women? And it was, back when kind of female power was starting to be a thing and we were having these hormones and everyone stopped hot flashing. And then it came to this abrupt halt in 2002 because, oh my gosh, it could cause an increased risk of breast cancer, which at this point, we've now really had a reanalysis of all this data that has been disproven. However, there is still this concept and forever, I think, debate going on for doctors that know a little bit about hormones / varying opinions. I would love to talk a little bit about synthetic versus natural or bioidentical hormones. And I would love to hear kind of your categorizing of synthetic versus the others and how you like to look at them.
Because prior to the WHI, we had Premarin, which was the most common form of hormone replacement therapy, which came from pregnant horses' urine. So not like our own estrogen, it wasn't bioidentical, but this was what was most common to be prescribed. And this came around in the 1950s. It very quickly actually became the number one most prescribed medication in the United States, which is just like mind-blowing to me. So you can imagine how many women were on Premarin around the world. They then put in that synthetic progestin in order to counterbalance the growth of the estrogen in the uterus. And so they had this progestin, which is a form of synthetic progesterone that is now in birth control pills, just so everybody knows. Yes. And then they had this Premarin. So it became number one most prescribed medication. When the WHI, as you said, it came out and then they halted it. And because they saw an increased risk, very small increased risk of breast cancer, an extra one person in every 1,000. When they looked at the two sides, right, it was the branch of the study where the women were on the progestin with the Premarin. And they had that increased risk of breast cancer. Well, the arm of the study where the women were on Premarin only had a decrease in developing breast cancer by 23 or 24%. So what that tells us is women that replace their estrogen with horses' estrogen,
yes,
have less chance of developing breast cancer than women who don't take horses' estrogen. So the bottom line, and this has now been replicated in the 1 million study that's now going on right now.
Yes.
The exact same thing has been replicated. The bottom line is Premarin is still better than no hormone replacement therapy, because it not only did that, but it also protected our bones really well, got rid of all the hot flashes, night sweats, the vaginal dryness, and helped with everything. And it showed that after 10 years of use, they did see an increased risk of cardiovascular disease and stroke. So they had this 10-year window where they were like, man, you could use Premarin in this 10 years.
Yep.
You're looking good. It showed a reduction in all-cause mortality by 33%.
Isn't that wild?
All-cause mortality. Isn't it? Name a supplement.
Name one.
It can reduce your risk of all causes of death by over 30%.
So going back to what you said, which I love that you called out that all oral contraceptives have a synthetic version of progesterone. It shouldn't even ever be in this that. Those don't go together. Progestins are not equal to progesterone, that are in these birth control pills that so many young girls are going on. A lot of women are prescribed them because of the symptoms that we've already talked about. The arm where people were given Premarin and progestin, we did see, again, very, 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 very slight, but a slight increase in breast cancer, which then allows us to conclude, because of people that have reanalyzed all of this data, that it's the synthetic version of progestins that was potentially causing this increase in breast cancer. And these are being prescribed by the bins every single day in women's health clinics without, it's something that I'm super passionate about, without informed consent on what the data has shown. And I think that, again, the OBs don't know what it's shown. That's one thing that I have a problem with. The other thing that you mentioned, again, with Premarin, which is pregnant horse urine, it has a whole bunch of different estrogens that our body doesn't recognize. Still, we saw a benefit. Then you brought up that whole 10-year thing, which a lot of my patients, when I started talking about this, when I wanted to implement this into my aesthetics practice, oh, yep, I got my 10 years and my doctor made me go off of it because I have a family history of cardiovascular disease. Well, we know that our own estrogen, as we're exposed to our own estrogen since we're, little young women all the way through these years, and then we all of a sudden become deficient. What sense does it make that we then go on a horse form and then 10 years later we have cardiovascular disease? Doesn't it make so much more sense, which now we know the studies show, estradiol, which is our bioidentical version, is now cardioprotective. And that is the exciting research that now people are starting to grasp onto and they're starting to want to see. And so I love that conversation of how different synthetic is not equivalent to what our body recognizes as self.
Yeah. And the Menopause Society actually came out 2 years ago and changed that statement of there's this 10-year window, because the thing is it's oral estrogens. So any form of oral estrogen, whether it's birth control or Premarin or bioidentical oral estrogen, it does raise your risk of blood clots, stroke, heart attack, because you're taking it orally. There is no increased risk if you take it transdermally. Mm-hmm. And transdermally is typically given as a bioidentical, so body identical estradiol that's going through your skin, either in the form of a patch, a needle, a cream, a gel, no increased risk. So now they've changed that and said, ladies, you can stay on your estrogen for as long as you want, because the benefits will continue past that 10-year window. And they're now seeing this and recognizing this. Yeah. And then you're right, like the whole birth control thing, it's like this is being handed out like candy, and women are being told, oh, you can stay on this as long as you want, when the research is now coming out that, oh, it does increase our risk of breast cancer. Mm-hmm. It does a whole bunch of horrible things to our brain and to our guts and everything. And yet we're putting 13, 14-year-old girls on it so that they don't have to have a period because they don't want one. Mm-hmm. And because they've got acne. Mm-hmm. And it's like, oh, well, and the girls are asking for it. The teenagers ask for it. Yeah. I want to go on this. I don't want to have acne. Mm-hmm. I don't want to have a period. Gross. Mm-hmm. And so mothers are like, oh, okay, yeah, no problem. You can go buy it in certain states now over the counter. Mm-hmm. Here you go. And you don't want your daughter getting pregnant. So great. Here. Yes.
To that point as well, I do think that that's a huge movement. I think it gave women, this sense of 100%. Empowerment, right? And I was having a conversation with a woman who works with me. She's just the most incredible human. Actually, I have a mother and daughter that work in our office as part of our patient care coordination team. And she's the mom. Her name's Heidi. And I had done a podcast episode on contraceptives, oral birth control pills, what they are doing to their body. We know this by research. We know this by clinically published white papers. And she said, I love that you brought that concept up, because we've kind of been sold this, like, here's control over your body, but how beautiful to, like, people have said to me, well, then what do you do for birth control? Like, why have we lost the art of natural family planning and knowing our bodies so well? And, there are other methods out there that are non-hormonal, contraceptives that you can use. But I just think that empowering women to know their bodies and to know, like, if I do have acne, like, what could be going on? Do I have some food sensitivities? Is something going on with my gut? Am I seeing a flux of hormones that maybe I want to address or identify why this is happening? I think that we really could flip the script and really empower women to know thyself so much better and not need to take some pill to control their body and what's going on with it.
Yeah. And they have to know that you're shutting down the most innate system in your body. And I'm like 100%, I am all for women's rights and to choose when she gets pregnant. Love that.
Yes.
However, the flip side of it is it's, yes, that's a nice thing, but there's consequences to that. And so educate yourself. That's why I'm like, please just make an educated decision on it.
Yeah.
And you can teach your daughters. And this is on us women at this age. You got daughters, this is on you. You've got to teach your kids to know their body, to listen to their body. My 17-year-old, she just had this crazy outbreak of acne, came out of nowhere just in the last few weeks. And so it's hilarious because she's like, okay, mom, I cut out gluten and I cut out the dairy. That's not what it is. Okay, I'm going to go use your red light therapy light.
That.
So she would never say to me, could I go on birth control pills?
No, she knows the resources.
She's trying to get to the root and trying to figure out what's going on. And I was like, you know what? You could just be having a hormonal shift.
Yeah.
And she's like, you know what? Mom, I think it was stress.
100%.
She just started school. And I'm like, oh, I've taught her so well.
Yeah. And that's the other thing is like, like you said before, I didn't feel like a stressed out person. We carry our stress so differently as humans, but specifically women, like we have been trained to kind of like hold it all together and show that everything's okay. And not only do we have to normalize that there are major stresses on our bodies, but even today I was thinking like, am I doing enough? Like still, in my 40s, I'm like, am I doing enough today? Like I had an amazing interview with another functional provider. I was with my team. We get to do this podcast. It's my best friend's birthday. Like it's okay to say that, to leave a little space for just moving through life and being present.
We're terrible for this.
We are.
Yeah.
And
we judge our worth on how much we do in a day. It's crazy.
Yes, it's wild. Yeah. Okay, well, I would say I would love to wrap up in terms of just touching on thyroid health and how this is such a conjugate hormone in terms of playing such a delicate role in everything else we do. I will definitely say from a clinical standpoint, I think it's hard to get women's thyroid levels to where we want them to be over 40 a lot of times. And I think it's also really amazing I think a lot of people don't want to be like on polypharmacy and you don't want to go on drugs. And I appreciate that. But I think also in terms of replacing these hormones, appreciating that thyroid also like taking a little desiccated thyroid can really enhance all of the other things that we're doing. And I would love to hear your thoughts on that as well.
Mm-hmm. Yeah, this is my theme for the week, actually. I just recorded a whole podcast yesterday on thyropause.
Oh,
and how
I
it's
love
this
that.
it's not being talked about enough. And I mean, I look at thousands of labs and I will tell you that more than half of women will also lose thyroid function when they go through perimenopause and menopause. And so it has to be in that group of hormones that we're looking at as women are aging. So it's got to be alongside the progesterone, the estradiol, the estrone, testosterone. And we got to look at the full thyroid panel, including the antibodies, because it's very well known that women can develop autoimmune conditions in perimenopause and menopause. And there's many reasons for this. Our stress, as I told you earlier, it gets higher. Stress can trigger an autoimmune condition. So if you've got the genetics for it, it can be like, it's epigenetics. We can flip on these switches because our stress gets too high. Estrogen, can help with gut integrity. And so does progesterone. So if we start to lose these hormones, we can start getting digestive problems. We convert T4 to T3 in the gut, but also the immune system and the gut are interrelated. So that can trigger Hashimoto's. So there's all these factors that go into how our thyroid is affected during midlife. And so stress is a really big one. We all know that, cortisol can affect thyroid function. So it can you could look like you have great thyroid levels, but if you've got high cortisol, it's going to be blocking those receptors so that you can't actually utilize those hormones. And then it goes on and on, but progesterone, estradiol, testosterone all impact thyroid function. And it's this two-way street. Thyroid can help everything else run well. And then all those hormones can impact your thyroid function. It goes back and forth, right? It has a tie-in with insulin. And so it's got to be looked at. And we start to see it's very, very common to see the conversion issue happen in perimenopause. T4 to T3. And this can be from nutrient deficiency, your gut not having, if you don't have good gut integrity. It can be, like I said, the stress. Like there's many different things that can cause that T4 to T3 conversion problem.
Yes.
Estradiol, we know, helps with thyroid receptor sensitivity. Progesterone does to an extent as well. There is a little tiny bit of research that shows that testosterone can help with the T4 to T3 conversion. I do see in clinical practice that progesterone will impact it, but there's not any research to show that. But I do see that. Estradiol is kind of a funny one where it's like too much estradiol or too much estradiol, whether it's your own or from hormone replacement therapy, can negatively affect thyroid because it can raise thyroid binding globulin. But the research doesn't support that transdermal estradiol and your own estradiol will do that. It's more so if you've got
an estrogen dominance kind of.
Yeah, like true estrogen dominance where you really have an abundance of estrogen.
Yes.
But what they saw, there was this great study that I found where it was on rats, unfortunately. So they haven't replicated it in humans, but they took the ovaries out of these rats and they saw that their thyroid function went down. And when they replaced the estradiol in those rats, their thyroid improved, their thyroid function improved. And so we know that estradiol can have a positive impact on thyroid.
Yes.
But we know that oral estrogens of any kind will raise thyroid binding globulin and make it so that you can't utilize that thyroid properly. So we always obviously want to go with the transdermal thyroid, but what we like to do is if a woman comes to us and we see on her labs that her thyroid is in the bottom of the range or under range, if it's under range, we will usually treat it with some desiccated thyroid or a little bit of T3, depending on what her labs are telling us. But if it's on the bottom of the range and she's got a little bit of symptoms showing that, her thyroid's not very happy right now, we'll actually optimize her testosterone, estradiol, and progesterone first.
Yes.
And we do that for the first few months, usually 3 months, sometimes even 6 months before we add in thyroid, because we see it often being enough to get that thyroid to start working better. And so we'll see the thyroid numbers come up.
Okay, I think that number one, the two biggest takeaways are there's not a woman listening to this that hasn't been touched by something that we've said and isn't completely resonating with them. And like, I hope that there's this aha moment that these women can find you in so many clinics around the country. And I love that you're in Canada because I feel like, that's a whole nother podcast probably to talk about healthcare, but I love that you are this wealth of knowledge, accessibility, and a commitment to more. But I also think that another takeaway is being patient with becoming optimized, because first of all, we didn't become unoptimized overnight. There are so many complexities that equal dysfunction in our bodies, and then talk about all the pathways and all the things that play together and how individual we are and how uniquely created we are. And I'm so grateful for you sharing your knowledge. I'm definitely going to put all of your information in our show notes so that people outside of what we offer and outside of Michigan and, you're an amazing resource to be able to get access to either the little bit of the group coaching all the way to the one-on-one care and really getting truly optimized. And I thank you for the work that you're doing and for being a trailblazer in this very new kind of industry.
Yeah, and we can give your audience, I don't know if you have this yourself at your practice, but we do have an over-the-counter concentrated
Ooh,
estrogen face cream.
I would love that. I actually,
That's
and you know
nice
what?
and clean.
We have our patients are becoming, I actually just changed up a lot of our skincare for that reason. And we have savvy consumers that are starting to think about what they're putting on their skin. And we have even savvier consumers that have asked me for clinical serums with a little estradiol in it. They know, and it's coming. And I think I definitely want access to all of those things so that we can throw those in the show notes and give people better resources to get in touch with you and your products.
Yeah. So let's tell them what coupon do you want? And I'll make it after we're done.
So the coupon code to be able to take advantage of this with a really great discount is going to be B as in boy or beauty, C culture 10. So BC10. And you can absolutely take advantage of Karen Martel's amazing topical serum with some estrogen in there.
Yes, it does amazing things for the skin.
Well, I get to look at you. I don't know if anyone's listening. They can't obviously see your beautiful complexion, but I will definitely be ordering some myself.
Well, I'll just send you some. But I honestly, when I hit that menopause phase in my early 40s, my skin, which had always been great, drastically started to shift, and my pores started to enlarge. And I'd never had that problem. And I was horrified. I was like, what? I had all these like great big, I could just see them all. And I was just like, what's going on? So I went on this rabbit hole, like, what can I do about this? And I came across this great research paper that showed that women that used estrogen on their face within 6 months had a 60 to 100% shrinkage of pore size. And I was like, sold. And it built the collagen up and decreased the depth of the wrinkles.
Yes.
So I was like, bring it on. And I've been using it on my face ever since. And then just this year, I was like, I'm going to do my own. And I put it out there, and it's just been like, it's been our biggest seller. It's crazy. It's crazy.
I love
because
that.
it's so fast to notice. You will not find pores on my face anymore.
I love
it really
that.
has changed. Yeah.
The other thing I see a lot in aesthetics is kind of like those little radial lines, the crepiness. We've all seen the little old lady with the crepey tissue paper skin. That is a woman screaming for some estrogen.
Yes. Yes.
Well,
Absolutely.
Thank you so much for your time today. I know you're so busy. You can catch all of her podcasts, which are all focused on all things hormone. And again, we'll make sure that you're nice and connected in the show notes. Thank you for your time today.
Thanks for having me.
Bye.